you want me to assign them their rooms now?
That'd be great.
Okay, you all should have little invites to rooms. You can join them. I'll keep an eye on it and make sure that you have someone in your room and you're not alone. Otherwise, we'll move you around a little bit. Okay, coffee and donut, I'm set.
Cool. Is everybody else back?
Looks like they're all getting punted back. Here we go.
Okay, you said 53 seconds. I was like, okay.
I came back with 1 second left, so.
Okay. All right, so we're gonna assume everybody's back. Hopefully you got a little something out of this case study and made your brain think a little bit. We'll just go over quickly a couple of the questions, just so we have time to get some of the other stuff that we want to make sure we get everything in today, right? And again, hopefully later you can go back and sort of think about it, because what I really want you to be able to do is to start looking through that case again, like if you have some time, and read through and think about what stages of the policy process, like where was there an identification of the problem? How did we start to think about who would get the benefits and the burdens of what policy? What are the differences between those two kind of policies? Like notice they were completely different as far as going on them, right? So if we're looking at the SSB tax, let's go back, let me show, oh, there it is. Okay, we're looking at intervention ladder, right? Where does that SSB tax, where might that fall?
Our group said it would fall into number 5.
Right, the disincentive, right?
Right.
Because so we're given that disincentive. We're using the financial or other disincentives to influence people not to do that, right? So when we're talking about the tax, that's where that falls. So, okay, so now we know where that's at on the intervention letter. But if we're talking about the case studies, how are they fitting then into the Schneider and Ingram model? Who are getting the benefits from this policy, or who's supposed to get the benefits? I mean, why would you make an SSB tax? What's the goal? Like clearly we're supposed to be trying to help people from becoming overweight, right? Like to reduce their obesity level. That was, and notice that we identified that really early on in that study for New York, right? Notice they said obesity was a problem. There it is, that's that problem identification. Now, remember I said we had to go to those root causes of that, right? And so we're thinking about that. That's who was supposed to get, again, supposedly, the benefits from the policy, right? Who's gonna get the burden here?
Poor people that can't afford
Right.
to pay it.
Yeah, and even it talked about the beverage people, right, that might lose jobs because, of course, if you have to increase it, your sales are going to go down, and then we might have to lay off people in the process of that, right? And are we really thinking about that? And notice politicians, their number one goal is reelection, okay? Number one goal for politicians, I know that sounds terrible, but it's actually true. So number one goal is reelection, and so anytime that you're talking about job loss, economics, so you notice that those lobbyists are powerful people, right? That's a lot of money spent on those two cases that the American Beverage Association was throwing at people, right? To make sure that they didn't lose any skin in the game, right? I mean, that was the whole point here, was that they wanted to come out on top. Now, of course, we saw that they didn't necessarily come out on top for the second of it, right? But what do we think about an SSB tax? Is that okay? If we're using it, like I said, SSB tax has been around for a lot. Soda tax, period, has been around for 100 years. So is it okay to use it as a revenue generator? Just the tax itself. Do we think it's okay just to have a tax?
Yes.
Our group thought so.
Yeah, it is, right? Because I mean, we've been using that. But now, what about as a public health initiative? Are we okay with that?
We do it with other things like cigarettes or alcohol.
But we're learning that that hurts people.
Yeah, disproportionately affects specific populations.
Right. And here's the other thing we have to think about. If sugar beverage was the only thing, the only causal pathway to obesity, right? Then we might be super justified to say we gotta go after this, right? But is that the only influence on obesity? So the question we have to ask, and again, there's not necessarily a right answer here. The question you'd have to ask yourself is, are we going to get enough of a reduction in obesity right? Is it really going to help enough for us to put those people in a burden to pay more for their soda, right? So that's that trade-off. Remember those ethical questions? Do the benefits outweigh the burdens, right? Are we giving this population so much of a burden to charge them more tax? And are we actually really improving the obesity rate? And if we're not doing that, then should we be doing the SSB tax, right? So, I mean, that's, again, these are just meant to make you think, oh, well, wait, unless we can show that we actually are getting this desired outcome from this, and it really can contribute to the SSB tax, then we should not be burdening that group of population in the past for that, right? Okay, so there's number 4, there's 2 reasons the portion cap rule did hold up to court, right? The first was that the public health department had overstepped, they did not, overstepped their authority. What could have been done instead? So they went outside their authority, right? They didn't have the legal authority to do so as the public health department, but who could have done that? Maybe the city council, right? Like if we're talking about New York City, right? If it had been legislatively passed, then there would be a difference because, again, we still might come back to say, okay, who's being restricted? Is it arbitrary type thing, right? Or they could have actually done where they were more like Philadelphia and included a wider range of beverages, right? So that might actually be a case. And it's interesting because what we see here, and I'm going to click through because I want to show you a couple things. So you guys looked at New York and Philly. So what we saw happen, because other places were trying to do that, right? So Philly was going one route, right? Their whole argument was that, and of course they had the court case to go with it, right? Argued it was a double tax, went to the Pennsylvania Supreme Court. But in New York, they were trying to ban, like they were limiting your choices, right? They were restricting, you couldn't have a beverage more than 16 ounces. That wasn't even a you pay a tax or you get a fine, you just can't, right? So see the difference on that intervention ladder of where you're at with tax versus where you are with the ban, right? So it does make a difference. And again, it also makes a difference as individual liberty goes and who gets the benefit and who gets the burden. So, but it's interesting because another thing that we see, look at this. So in California, okay, because this brings us back to the idea of preemption. There were bans in Oakland, in Berkeley, and in San Francisco. So the city took it upon themselves because we didn't have a soda beverage tax in the state of California. So the cities are like, okay, well, we're going to pass one because you don't have that. You don't have a thing that says we can or we can't. So we're going to do that. We're going to think about that as there's nothing here, so there's no floor or ceiling when it comes to SSB tax. Well, as soon as that happened, of course, here comes the American Beverage Association, right? And convincingly, they convinced the state legislature. They did not strip Oakland. They did not preempt Oakland, Berkeley, and San Francisco of their power. But what they did do was create new legislation that said no new soda taxes. Yeah.
Oh, we can't see your screen if you started sharing again.
Oh, you can't? Okay, thank you for telling me. That's interesting. Oh, I think it's because of the breakout room. It's probably when I went to the breakout room, it doesn't let me, you know what I mean? It takes it from you. Here we go. Thank you.
Yeah.
Share. There, better?
Yes, thank you.
Okay, so again, California, like I said, they put in that city ban because there wasn't a floor or a ceiling for the state of California or for the federal government for that matter. But instead of preempting them and taking it away from them, they just said no new soda taxes until 2031, okay? So we do see that there are differences in how states and local governments, right? Philadelphia is the city, New York in this case was the city, California was the state that came to preempt those cities that had passed their soda taxes. So the whole point of this is to think about like who is getting the benefits, who's getting the burdens, where are we at on that intervention ladder, who's involved? Is it actually the health department trying to make a decision? Do we have the legislator involved? It's really interesting that we just looked at that Schneider and Ingram thing with the immigration, because as you guys were in your thing, I saw on my phone had passed up from the New York Times saying that the Supreme Court just ruled that President Trump can't single-handedly brought here, or that Obama signed as an executive order, and Trump said he would get rid of, right? Well, now here's what's interesting about that. So remember, I considered Dreamers in the contenders, right? So clearly they were on somebody's radar, right? Because the president wasn't allowed to just get rid of it, because the court could have easily ruled that, okay, it's fine for him to do so. But instead what they said, now they didn't rule on his policy yet per se. What they did say was that he didn't give enough evidence, right? Because they're in that protected class. Think about that. Think about that strict scrutiny that he's going to be under to be able to get rid of this, right? For that group of people that is considered those kids who were brought here when they were children illegally. Okay, so we are in our seat. We just saw it today. So how fun is that? All right, so everybody basically hopefully enjoyed that case study a little bit. We do have one more, so I want to get us through so we can finish it. The next one is actually really fun, just because I think most of you will enjoy it because it's from Montana. So we've got a lucky one there. So let's go on to the next part. We want to recap this. So we've spent a long time today talking about government interventions versus individual liberties. How about what ethical things we need to consider? Remember, that's really the benefits and the burdens aspects. Those social constructions that Schneider and Ingram have helped us sort of look through, and remember, we can do that for both issues and with people, right? Who's getting the benefits and who's getting the burden? And are we actually getting the benefit more than the burden, right? Where are we on that intervention ladder? And are we going to be justified legally by the judicial system to be able to say we did that, right? So now we know why, but how? How do we do this, right? So of course, 6 steps in policy development. This is interesting because the reality of this is that we've been talking about this all day, right? So this is just sort of a little bit of a refresher as we get to the next piece to make sure we're all on the same page. It sort of talks about it just a little bit differently, just so we can think about it maybe a little more scientifically, right, as far as that goes. And of course, we always, in this section, we're going to talk about the 6 steps in policy development. We're going to talk about how to engage stakeholders and build momentum, and then we're going to talk about that built environment case study, okay? So policy development, back to that, define and understand the problem and its causes, right? We want to make sure you're understanding what that issue is, and not only do we recognize what the problem is, whoever gets to define it wins. Think about this. When we talked about global warming, right, all anybody had to say was, it's colder this year than it was last year, and global warming was sort of thrown out the window, right? Once we got to switch that definition to climate change, people take it a little bit more seriously, okay? So defining, not only knowing what the problem is, but whoever the definition wins, right? The next thing we want to do is like clarify which of the causal or contextual factors are the most apt to change, have the greatest scope for change. Where can we get in there and make that change? And of course, to do that, we want to make sure that we're using data, right, if we possibly can. What have we seen work and what are we seeing that doesn't work? So then we have to identify what's that change mechanism. What are we going to do? Is it going to be a tax, right? Is it going to be, you know, we're going to offer something to someone? Are we going to open a new program? Are we going to get people into housing? Like, where are we going to do that? And how are we going to deliver that change mechanism? So think about, are we here? Do we need to get involved in more than one place, right? More than one place. So honestly, when we're talking about these different ones, right, it's easy for us to go, we want to test and refine them on a small scale, and then collect sufficient evidence for their effectiveness, right? And I'm going to look at a couple of these just by themselves because I already talked about this piece of it. So I'm going to scooch through here because I want to know the greatest scope of change. What system is this part of, right? In this scope, is this a primary prevention or a secondary prevention, right? Are we talking about limiting smoking? Are we talking about what are we doing for people who are already smokers, right? Where are we at? Which is the mechanism that we want to do? Because if we just want to reduce smoking, how are we going to do that? Which of these places do we need to plug in, or does it need to be more than that? And the reason I'm asking that is because that change mechanism, we can actually use program theory to do this. And I've included this theoryofchange.org. This is actually really great. There's some really good examples on there. For instance, there's one called, I think it's called Superwoman. And it's a program to help, it's a program, not a policy, but it is a program to actually help battered women who have been victims of domestic violence to get back on their feet. And what they do is they show you how you can use theory of change And really, it's a lot of backward mapping, right? So here's our end goal, and how do we get there? You can sort of see how you can use those change mechanisms. What levers are we going to pull? So when you get some time, check that out. And of course, we want to involve the stakeholders, right, as when we're moving through this. How are we going to deliver this? What's the change mechanism, and who's going to be in charge of this kind of a thing, right? And then I want to just jump to the next piece, because this is going to come into play with our last case study, is testing and refining on a small scale. And we don't always have the option to do this, but anytime that we can sort of do like a pilot or a test run for the thing that we want to do without overhauling it into everything, right, that helps us out tremendously to be able to see if we're getting where we want to do. Because at the end of the day, right, if we haven't talked about who's going to deliver this, who's going to reach it, who's doing the job, right, if we don't have that evidence, we can't justify implementing it on a wider scale, okay? We can't do that. Okay, so let's talk for just a couple minutes here about engaging our stakeholders, right? Because this is really important for us. As I said, here's how we do this. The first thing we want to do is this. We have to identify who they are. Well, that makes sense, right? But they might be individuals or groups or whole organizations. So we have to think about it. We want to cast a wide net. We do not want to miss anybody. We specifically do not want to miss those negative stakeholders, right? And then the next thing we want to really do here when we're talking about stakeholders is this. Who are they? Who are they? Because if you can't analyze and understand who they are and what they're bringing to the table, right, you can't really engage with them. We can't just be like, oh, these are the people that should be involved. We need to get to know who they are, what these organizations are, why they care about this issue. Why are they stakeholders, right? Now, hopefully when you're developing policy, you have a team, right? We're hoping that there's a couple of you working on this situation so that you can really see that and be able to allocate your resources accordingly. So you want to do that. And the way to do this is to come up with a plan. So I've talked a little bit about politicians today and how they're trying to get the things through that they can to get reelected. When you're trying to create a policy, you are in a campaign of itself, okay? You're campaigning to get to your outcome, right? And this means planning. What is the message you're going to give to these stakeholders? How are you going to get them involved? How are you going to get everybody to sort of see that message the same way? And once you come up with that plan, then you have to act, right? You need to go move. You're going to get resistance. You need to decide how you're going to take that, right? When a negative stakeholder comes throwing something at you, now hopefully in your plan, you've thought about what that negative is going to be, and you're able to have a good response ready to go. But almost always, think about this, you bring up a new idea and somebody shuts it down and you look at them and think, I didn't even think about that, that's insane, right? Or what? And if you react in a negative way, you're never going to get that stakeholder off. So what is your process for when you act? How are you going to take in information that you weren't expecting to get and then come back down and sit down? And so you need to plan through these things. And when you go to act, like I said, you got to think about it. And then when you come back, you really want to be able to review. You want to think, okay, is this where we thought we would be? Because stakeholders are going to come and go throughout the policy process. Some of them are going to be there the whole time. Some of them are just going to be there for the problem ID. Some of them are just going to be there to help through the legislative process. So think about that. Are you really engaging with people in the way that you thought you could, right? In the way that you thought you could. So influencing strategy, right? The big three emotions. So a lot of the people that you're going to deal with are going to be business people, right? Because even though you're all in public health and you're trying to do public health policy, think about this. If we're going after, like, let's say e-cigarettes, right? Like a potential, we want to decrease that, right? The business owners are the ones who are making the money off of this, right? Of selling this. So you're going to have to be involved with them. And so part of creating your policy and selling that and engaging, because they're stakeholders, and again, they're against you at this point, right? They don't necessarily care about your public health stuff because it's going to cut down on their money, right? So here's the big three emotions that we can think about: values, desire, and fear, okay? So business people almost always will tell you about their business values, right? Think about this. Our family-owned business has been here since this. We provide blah, 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 right? So if you can align your proposal and you can say, oh, that fits with what we're trying to sell here, right? You make it harder for them to reject you. Desire, this might even be greed. This is called the wham factor, right? The what about me? So even even if the policy is not going to give them a benefit or the burden, they still want to know what's in it for them, right? How can they further their career or better serve their customers or strengthen their network, right? And of course, fear, we have to be careful because we don't really want to use fear if we don't have to, right? And really what we see is that we actually just have soft power, right? Soft power. It helps us to shape our stakeholders' perceptions and opinions, and it reinforces supportive perceptions and opinions and helps us really to shift critical perceptions and opinions. So I think we have there's four basic pieces that we can talk about. And one of those is our reputation. You know, you have that reputation as a professional. And if you can show stakeholders, you can show those people in your community that you know what you're talking about, you're going to have a much better chance of reaching them, right? And then attraction. 3 things attract people to you. Charm, if you're likable, right? Do you smile? Are you out there? Do they see you? Are they familiar with you? We like people that we know, right? And more than that, are they similar to us, right? So charm, familiarity, and similarity, that's what attracts people to you. And the greater you can do this, and of course, this is by coffees and meetings and phone calls, right? This is where you hope you have a team to help you out. The next thing is motivation. That's a source of soft power. So there's 4 types of motivation, but only 2 are used here in soft power. People really like to be part of a group. So we have that in social motivation. If they feel like they're on the outside, it's a better chance that they want to move on the inside, right? And then there's that intrinsic motivation that basically says, hey, I want to be part of this process because I don't want to feel like you took my power away. Okay, so we want to make sure anytime we can motivate somebody socially or intrinsically, that's just a form of soft power because we're not making them do anything. We're giving them, you know, those options to be part of this group. And of course, in relationships, always important with stakeholders, and that takes time. Relationships take time, but it's worth it in the long run if you can build up those things, right? You can build up those relationships. We can get in there and they're going to help you to build other relationships, right? And again, hopefully you have more than one person working on this policy development, because if you do, then you're able to actually get in there and work with them. Okay, so now we've done all these things, right? We've done all these things. So we only have one more thing to talk about, and then you get to finish up your last case study, and then we'll be done for the day. But when we thought through the policy process, when we've decided what the problem is, when we've looked at the policy options, when we've thought about our legal standing, when we thought about what levels of government this has to come from, when we know who the stakeholders are, when we figured out how to use our sources of soft power, when we know where people go on the social constructions table, we've done all of these things. Now we're ready. We're trying to get to that. Remember that policy window we talked about at the beginning today, where those 3 streams have to come through? At some point, we have to get enough momentum to get it through that window, okay? And so there are just a few quick, easy things that we can think about. How do we build that momentum, right? We have to communicate the why. Why do we need this change? What's wrong with keeping in that same regular thing we've always done here? Who cares, right? All of that, explaining how those will benefit your individuals and your communities is critical, right? If you can tie that benefit to something for this community, you can actually do that. People start to get passionate about that. They want to help. If you can come up with a catchphrase or a line or a tag that says, oh my gosh, let's go to this. And then of course you have to stay the course, because if they start to see you falter, you're in for a very tough time, okay? The second thing is, it's your job to paint the picture, right? What are people moving from and moving towards? Nobody, I mean, honestly, let's think about this. No one really likes change, right? It's so much more difficult to get people to change. So you want to paint the picture of why. What is the difference? How big is the gap? If we're here and we want to get to this next level, how much of that, right? What does success look like? How much are they going to have to actually put in? I mean, if you're going to make me make a change, am I going to have to learn how to walk? Am I going to have to learn how to run a marathon? Or do I have to become a triathlete? Think about this. No one wants to have to be a triathlete. So if you could paint me the picture that shows I really just have to take a few steps, setting some sort of reasonable expectation, once people realize they're up to that task, right, it moves them forward. And then they get excited. Again, common focus, team focus, it's a goal. Of course, how are we going to get there? It's your job to be the guide. I mean, if you're really involved in this policy development stage, right, if you're designing policy or you're pushing for a policy, you need to guide the stakeholders through what that means. You cannot take for granted ever that they understand completely what it is, where you're going. You understand that, your team understands that, the people who are working with you on this policy issue, but not everybody understands that. So somebody has to guide them through that so they understand. Of course, then you're always going to get resistance. Nothing ever goes through, right? Two things about policy. There's always going to be a burden, and somebody's always going to push back for some reason, okay? You know it has to be. So you want to make sure that you're prepared for that, okay? You're going to have to prepare for this so that when it comes up and it pops up, you can have people go straight for that resistance and see what you can do, right? And you need to acknowledge and celebrate milestones, right? At some time, maybe it's the baby steps along the way that actually are worth it, right? Maybe it's those times when you got one more legislator to say that they might actually care about this, or that they might vote for this, or that you saw the city council maybe is not resisting as much as they used to be. You've had a change in council members, and yes, now you didn't get it passed yet, but you saw a change, right? So if you want to keep the momentum going, you have to keep that positive stuff coming. You want to decrease as much negative as you possibly can and celebrate those milestones. And again, the policy process is long, right? It's just long. And it takes too much time, and it's frustrating. So keeping the momentum going is the most difficult of all the pieces, right? Because you have to be the cheerleader. Whoever is creating this policy has to have enough to keep it on the agenda, to keep people passionate about it, to keep people moving forward. So again, celebrating milestones helps us to do that. And most importantly, you have to manage yourself. How many of you, I already know the answer to this, it's all of you, work too much and too hard with few resources and limited time, right? So the problem is this: nobody's going to want to think about it. Do you want to listen to somebody talk about something who seems exhausted or stressed or overburdened? If you're responsible for leading the change, right, you have to start by getting your own house in order, right? It's necessary, but you need to take breaks, right? Honestly, if you're trying to build momentum, everybody's like, I can't stop, we have to move. No, because when you get too exhausted, when we're too tired, when you have given everything you have, right? And this is where you hope that you're working with a team of people that's trying to keep the momentum going, so that somebody in your team can look at you and go, you need to take a break from this, because you're not going to help us if you're not okay, right? And I think we too often just keep going until we just fall down, right? We really can't do that when we're trying to keep the momentum going, because when we look exhausted, everybody else who's been part of this policy process is going to look at us and go, yeah, I'm tired too. And then we lose it. We lose all that steam. So really, if there's an issue or an area that you are so passionate about, that you know there can be policy change, whether it's at the federal level or the state level or in your own town, right? You know, I really hope that after today you'll understand the importance of how much, A, the need for public health people to be involved in this process, and two, that it's not easy, and that there's going to be a steep learning curve, right? You're going to have to really work it and get comfortable with people who know some of these pieces to help you out. But really, again, it's so worth it in the end, right? Think about if that one public health issue that is really detrimental to your community, what if you could go to work on that? What if you could actually come up with good public health policy that made a difference in that community, right? We're going to see how this sort of works out. Okay, so all of you should have what I'm calling the Tobacco-Free Parks case study. And let me just say here, so before you go off to read it, again, this one, it's a little longer, but not, because it's not two separate things, it's one thing. And a lot of you, I'm sure, are familiar with Tobacco-Free Parks initiatives, right? Living in Montana. Part of that built environment type change that we would like to make. But I wanted to be sure and give plenty of credit for the information in this case study. So this information in the case study was actually submitted in 2 separate assignments by a student of mine. Her name is Heather, from the My Health Policy course this past spring. What was really interesting in this case study was this. She turned part of this in as a policy brief early in February. And I was interested because I saw she was making some movement on this, and I have had other students wanting to make the same kind of changes in their community. So I was interested in where she was getting resistance, if it was working, that kind of a thing. Well, so she gave me some information. And then as we progressed through the semester and I was looking for this and thinking about something we could use as a case study to look, some more information came up and she turned in the second piece of it. Well, once she did that, I realized that thinking about all the things, and this is what I want you to think about when you're reading this case study. What's the problem? What's the policy? Who's going to get the benefit? Who's going to get the burden? Where is it at on the intervention ladder, right? Who are the players? Who are the state? Like, as you're just reading, like, hopefully it starts to jump out at you a little bit. You can go ahead and scroll down, I would suggest, and read what the discussion questions are going to ask you at the bottom, just so you sort of know what you're looking for. But really the big piece of this case study is to sort of see how it all comes together. This case study is a really nice reflection of all the different places that we've talked about today. In policy development, who are the stakeholders? What about momentum? Think about momentum as well when you're reading through this case study. So go ahead. What I'd like you to do, again, she was nice enough to give me both pieces. What I did was cut and pasted from her two things to give you this sort of case study that gives you the backbone of what it is. So go ahead and take a couple minutes, a few minutes here and read that, and then we'll talk about that. So read, read, read. Once you guys are finished reading through this, go ahead and just jot down that, some ideas about what might answer those questions. So, since we're on time constraint here, we want to make sure that the most important part for me is that you get to read through it, and then we can start to think about, and I'll give you some pointers of things to think about as we move, because you can take this with you. So you won't have to go in a breakout room, but if you can come up and think about it, answer some of those questions quickly, like where do you sort of sketch this out as you're finishing up reading? Yeah, we're just really, like I said, we're just gonna look, we're gonna sort of walk through this a little bit. I just wanna show you and how we can sort of see it, I'm hoping anyway, right? As we come along here from these kind of pieces. So if we go back to the beginning, right? So basically in that first part, right, she's giving us this background information, which, remember I said, if we're going to make some sort of policy change, we want to have as much data and information as we possibly can, right? So she's also making a really good argument here that this is the leading cause of preventable death and illness at the global, national, and local level, right? She goes in to discuss a little bit more than that, but notice at the beginning of the next paragraph, right? She says, despite substantial progress, smoking remains the leading cause of morbidity and mortality nationwide and in Montana. Two things should stick out for you here, right? A, she's identifying the problem, smoking, identify the problem. But look what she's doing. She's saying the leading cause of, morbidity and mortality. Remember we talked about the ethics, we talked about standing up in court and who has authority to actually pass public health laws. Why do we do that? Because if we're attacking something that has to do with morbidity or mortality, we have a better leg to stand on, both ethically and then also in a court, right? So there it is. She's already giving us that piece of it, okay? And so then as we start to scroll down again, more data, she's talking specifically about what's happening related in Montana alone. And then she moves into the county, right? She starts talking about that community health needs assessment. And a lot of times that's what we have to do. Sometimes during that policy process, remember when I said we sort of had to evaluate, remember the early policy process that we've already talked about, and how the CDC put that evaluation all the way around the circle. So one of those types of things would be a community health needs assessment. That's an evaluation to sort of see that now she's got data to say there's a higher rate of smoking, right? So that's alarming. Great. So now tobacco, she gets to the part where she tells us that it's increasing for youth, right? The Youth Risk Behavior Survey didn't give us some very good things, right? So, okay, now we know that this is a problem. We've established it. We've established that there's some authority here because it's an issue in Montana, not to mention the rest of the country, but it also is a morbidity mortality issue, okay? Now, if you look at the next part where she talks about interventions, notice here that they're not going after smoking totally, right? This entire intervention is not about no smoking ever, right? It's not about taking all that, it's eliminating choice, it's totally gone. So if we're thinking about intervention ladder here, first of all, we're not that high up. Second of all, if we're talking about this policy is just a piece of it, right? It's addressing one of these root causes that goes to that piece, that overall to decrease smoking, right? So this is what she's first telling us here. This also, again, notice her first line here, a proven intervention strategy, okay? What did I tell you earlier? I said we don't want to reinvent the wheel if we don't have to. Do we want to start from scratch, or do we want to show, we want to be able to tell people, convince people, engage these stakeholders and build momentum by saying, hey, look, this has been used before and it works. We don't have to start from scratch to create a policy that does this, right? So if she looks at this, she goes in to tell us what a big deal it is to have the secondhand smoke and how much it actually even is detrimental when we're outside, right? So that's a really good selling point. That's that message. When you want to package the message to stakeholders, part of that is what she's doing right there, is explaining that while we all understand secondhand smoke in the house, what does that mean when you're outside, right? Because people are like, I'm outside, what's the big deal? There's that part of that messaging, right? And she gets through that in the next paragraph when she's talking about, furthermore, people who use tobacco themselves are not excluded, rather the exclusion is the act of smoking and vaping. So notice here that she is talking to us about who's going to get the benefits and who's going to get the burdens, right? She's basically telling us, look, these kids, people who have disabilities, people who have asthma, who are children, when they're coming, they can't come to these parks if they're smoking there, right? So tobacco-free environments actually let them in. So all of those people are going to get the benefits. And who's going to get the burden here, right? Well, the burden's going to go to those who are smoking, right? But is it such a burden? Because it's not telling them they can't smoke anywhere. You just can't smoke at the park, right? So they have to go, if they're coming to the park, and again, you could choose to come to the park or not come to the park, right? But if you chose to come to the park, you would then have the burden of not being able to smoke while you were there, okay? And then if we're weighing the benefits versus the burdens, think about that as we start to think, oh, look at all these people who can benefit, and really is the burden that high? No. I mean, as far as individual liberty goes, if we're talking about community action, if we go back to that social compact theory that says all of us are somewhat responsible to one another for the health and safety of the whole community, doesn't this fall right in line with all of those things? Right? So then if we start to move down here a little bit more, right? She says, right before the environmental impact, she's framing this on how to present it, right? Tobacco-free policies support a normative message that tobacco use is unhealthy and undesirable to individuals who do not use these products and is not the social norm, right? She's framing this issue. She's showing us how do we get people on board with this? How do we get people to move and make a behavior change, right? How do we get people to be passionate about the fact that we should get this policy through, right? And she's also framing this as far as environmental impacts go, right? This is a really good way. This is the what about me factor, okay? So she's talking about how much trash, how much decomposition. Think about all these things. So even if you didn't think you were involved in the whatever, I don't go to the park, I didn't do this, but maybe you have an environmental component, or maybe even some of the smokers have an environmental component, you know, and they feel bad that all those things are happening at the park. And so even then you could convince them. So she's giving you different frames, right? It's because you know you're going to have different stakeholders and you need to get everybody on board one way or another, right? Okay, so if we jump down to that next section that says tobacco-free parks, she tells us legally federal and state laws in the US allow for local governments to regulate tobacco use in outdoor environments, including parks. So she has that, right? She's let us know that preemption is not going to be a problem, right? So that's the whole point of it. She's thought through the process of how do we get to have this? And clearly she's cited the Public Health Law Center here, right? So fines or penalties can act to strengthen the policy, but it's primarily dependent on social enforcement. And there is a distinction she lets us know here, right? It's this voluntary type of cooperation. So there's a difference between a resolution and an ordinance, right? In both cases, we're asking people not to smoke, it's prohibited, but resolutions typically rely on public cooperation. That's that voluntary power, remember? Whereas that if you have an ordinance, then there's policy language has to be articulated to include your alternatives and what you're going to be using for that. I do like that she includes the cultural considerations, right? Especially when you're talking about tobacco use. We have to be really careful that we're not going after a particular culture when we're talking about these things that are used for ceremonial or spiritual matter. And we have to make a huge distinction, right, between commercial tobacco and otherwise not, right? So in accordance with this, we need to, again, when our policy is created, we need to think about those things, right? And then as she moves through this next section, she tells us this is a really great opportunity for us, right, to have a positive impact on the health of this. And so she talks about this, she says the CDC lists tobacco-free parks as a best practice, right, intervention strategy. So in that policy development stage, do we have data to back this up? Yes, we do. It's a best practice, right? And then she goes on to tell us, remember from the very beginning of today, she said these policies are almost exclusively enacted at the local level. Oh, see, there's those levels of government. But she tells us success in 11 other municipalities indicate it would be what? Feasible, okay, right? Because remember, we want it to be efficient, effective, equitable, but is it feasible? And she's showing us here how, wait, it's been done in 11 other places, right? So I hope you caught that when she said, it's feasible to do it here, right? What does that mean for us in the long run? So of course, this tobacco-free parks, if you go to the next section, she says, armed with all this information, a tobacco prevention coalition comprised of who? Look at all these stakeholders, policymakers, park staff, partners in public health, parents, and other community members was formed, right? So she's including stakeholders here, and that is a wide-reaching net, right? She also had existing partnerships with the City Parks Department and the City of Bozeman staff. Again, there's that feasibility, right? And in the next paragraph, she even actually says that they're going to gather qualitative and quantitative data. So you're gathering that data, that's part of that policy development thing, and to say, hey, what are we doing here? So then she goes on to highlight what kind of data that they collected here, right? And then she says, finally, there was a survey distributed, again, with the stakeholders. You're talking to the residents of Bozeman themselves, and these are the smokers and the non-smokers. So you've got who could potentially be negative stakeholders involved in your survey, which is great because that means she didn't leave them out, right? She didn't leave them out. So notice that is a really big deal here, right? They didn't leave out those smokers. They didn't just ask the people who wanted a healthy Bozeman, right? They asked everybody. And what they found was the results, approximately 12% of the respondents indicated that they were current tobacco users. So that means they actually got a good sample, right? So then what they were able to do, looking at the amount of partners, watch this. Here's that pilot project, right? It's number 5 on that development part. If you can do it, right? It was a little more palatable, a little more feasible to start small and then see if it was working, right? And then to see if it's working. And look, as they were doing this and they started to roll out this campaign and people were doing, other strategies were used. There's that momentum, right? There's that Facebook ads and Instagram posts and t-shirt contests and health fairs, and letters to the editor. Oh my goodness, look at all the partners, look at all the stakeholders that are coming together here that are actually helping to build momentum for this and to keep it on people's radar. Oh yes, we have these 2 parks, right, that have this tobacco free. And then they started to think about this. They went back and they did follow-up data, okay? Went back and did the follow-up data. So now we have actually gone through all of these stages. And so with the promising results in the pilot project, right, it was time to think about expanding it to the rest of the parks. So one source of contention was to keep a resolution or to move to the ordinance. There's that policy analysis. What are our options? Do we keep it here or do we move it up the intervention ladder to here? Right? Are we asking people to do something voluntary? Are we asking somebody to do mandatory? Or are we asking somebody to do something compulsory? Right? So she's weighing those policy options. So of course it was determined at that time they didn't have time or the resources to run around, you know, actively enforcing it as an ordinance. So they decided to pass a resolution. And notice that the Parks and Recreation Director was also on the Bozeman's Recreation and Parks Advisory Board and was a member of the Tobacco Prevention Work Group. This is a key stakeholder right here. Notice, because this person has all these people that he can come in contact with, that he can make this work for us, okay? And then finally here, notice she's not reinventing the wheel. They're using what Helena had already done, right? It was already there, already passed a resolution, did not start from scratch. Of course, here comes COVID-19 to get us down at the end, right? Unfortunately, due to the coronavirus, adoption of the resolution has been delayed. So the only thing that I can see in this, right, where they really are having this issue is the idea of building momentum, okay? Because it was there. They were right there. If they could have brought that resolution to the meeting the next time like they were supposed to, you know, she knows she had support from 4 of the 5 commissioners. There was it. Now it's been sitting since March, right? So that would be the only piece of this at this point that might take a little more back to the, we got to get back in there and pump this up, okay? So hopefully, like I said, as you look through this later, you can actually even start to think about, oh, I am seeing that those pieces are starting to fall in place. And that, again, is a true story from there in Bozeman, okay? So hopefully you've enjoyed that piece of arguing things. So just quickly, again, we're in the intervention ladder, making healthier choices the default option. If we moved it to an ordinance, we'd move it to regulate or limit choice altogether, right? This is a voluntary power because they didn't go to that next level. Of course, we talked about the burdens of the smokers and the benefits, you know, too many benefits definitely outweigh the burden. But this also goes through those 6 steps of policy development. Again, the only thing I would argue is that maybe the momentum is going to be an issue at this point just because they didn't get this stinking thing passed before COVID hit, right? Stakeholders seems like they did a really good job with having the work group created at the beginning to actually be able to include a whole bunch of stakeholders and people, like I mentioned, the super stakeholder that was involved in several aspects of this. So really that, I mean, again, this is an excellent case for what we covered today to show that. So hopefully you've enjoyed that piece of it. Does anybody have any questions? I know we're right at time, so.
Amy just had a comment in the box, the chat box, but.
I can't see.
Oh, she just
I
said.
mean, I can. It's not. Go ahead, read it to me. Thank you.
She just says, I thought it was super cool that the health department in Bozeman did mixed methods study about public perception and enforceability.
Exactly. I mean, it's like, I mean, this, it could not be more perfect to have used as a case study. Like I said, fortunately for me, Heather did all the work, right? She put it all together, but she was working on it. I mean, this was her, she's one of the players. Again, she wasn't doing the whole thing by herself. As a matter of fact, it was a 5-year deal. She's only been in on that for like 2 or 3 years. So she even came in, new players are coming and going all the time. But I do think it's great because they were able to use that survey component and then they went out and collected stuff. Like there's no arguing that people supported this and that they could make a difference by doing that, right? So, and anytime you have that, like it's really hard. But again, who are the people voting for the program, right? If you had that whole council that was smokers, are they going to vote yes or going to vote no, right? I mean, that you're still going to hit that roadblock at the end of the day. So, other questions? Well, I've had fun today. I hope all of you have had fun as well. I'm going to click to this next screen that I know that's just the references and resources. So all the things that I've talked about today are here. And I know I didn't bring up the Superwoman example. I told you that on that theory of change, but I did go ahead and put it here. So like I said, you just go to theory of change and it's one of those Project Superwomen. And then I know Emily has this for you if you guys would fill out the evaluation.